Going. Perfect. So great to see you all here, and thank you for coming for this seminar, which we're very excited about. As you know, the seminar is part of a NIDA-funded initiative to advance the science on recovery community centers, and here is our steering committee that discusses all of our initiatives, including the seminar series, as well as our project, our funds that we have for people to conduct pilot studies that you've heard about, as well as the repository of scales that we collect in case they're useful to anybody conducting research in this area, and that keeps on growing. So these are the people behind the scenes, as well as our support staff. Catherine, Deodora, Lily are here with us. So here you have them. The next slide, please. As you know, our goal is always to bring together multiple stakeholder groups. All of us are very used to being in our own silo and discussing things together in our groups that we affiliate with the most. But what's most informative and most helpful is really to reach across to other groups who are also active in this sector that we have less access to. And in this seminar series, we try to get us all together, and that includes healthcare decision makers, prescribers, clinicians, scientists, RCC leaders and staff, peer support workers, volunteers, RCC participants, recovery advocates, and more. Anybody who wants to help in this space and wants to contribute and be part of a discussion. This is what our membership or our attendee demographics look like in the past in terms of who's showing up. And every time we ask you all to complete a poll, and Catherine, if you can start that for us, we try to keep track so we can know if we are losing folks and if we need to reach out to groups to have represented here. So if you guys can, per usual, go ahead and complete these demographics for us. And the last couple of questions are about today's topic. So if you can take a moment to just go through here to complete the boxes, and then on the right, there's this gray bar to scroll down. And then at the very bottom, you should get a blue box. And if you complete it, there should be a blue button, and you click the submit, and then goes in. And Catherine, you can let us know how far we've come in completion so far.
Mm-hmm. We're at 43% right now.
Great.
And we're at 70.
Awesome. Thank you, guys. It's amazing how 2 years of Zoom will make us also familiar with these things. All right. How about now, Catherine?
It looks like we're at 79%.
Anybody want more time? And as always, feel free to unmute yourselves and speak right up. All right, hearing nothing, if you can close it up and display it for us. Actually, I think we have to click through it ourselves, right? Yeah, okay. So for our 3 questions, which you saw at the end, which is all about RCCs and how how well they integrate cultural elements into their services and their outreach. 96% of us here believe that RCCs should be held more accountable for providing services in the appropriate language of their community. That's a pretty high number. 94% also believe that funding agencies of RCCs need to make sure that there's dedicated budget space to enable RCCs to be able to do this. And then there were some questions about ideas or potentials for how you can help or support or ensure and hold accountable for creating that. Fines was the least popular option, but audits had a 40% buy-in from folks. Having it be part of certification accreditation processes was 76%. A lot of us, 89% of us, think that trainings on diversity, equity, and inclusion should be very much incorporated. And then in terms of somebody else monitoring your social media and kind of seeing how well you are doing this, 41% thought that was a good idea. And of course, as you're listening today, we'd love for you all to share ideas what you think should happen in this space to help us move forward here. That would be great. Put them in the chat, and hopefully we'll get to it at the end of our seminar to talk about it too. All right, next slide, please, Catherine. So as you know, we usually start with a live feature where we have an RCC director or staff member or both present to us about what happens when you walk through the door of their particular RCC. And the idea is always to give us all an idea about, what an RCC is, how they function, what does it look like and feel like. This time we have two RCC directors today, but we were hoping to have three. Yamila is currently out today. But we have three of them present and share their story. So we wanted to keep as much time for them as possible. So we have put their videos instead here, and they are also on the website. And Lily, if you can throw those in the chat for people to use later, and also will be in our email. So you can look at those videos, hopefully, to get a really good feeling for our three presenting RCCs. Next slide, please. So what we're going to do is we're going to start out by giving you a little bit of background on this issue from a perspective of science, what is known in science, and how does that tie into recovery community centers. So our speaker today is Dr. Miguel Pinedo from the Kinesiology and Health Education Department at the University of Texas in Austin. All right, over to you.
Well, good morning, everyone. Can everyone hear me?
Absolutely, loud and clear.
Thank you for the invitation to be here. So I'm going to keep it very brief. So if we go to the next slide, just giving you a little bit of an overview of my work, which focuses in part on use of alcohol treatment services among Latino populations. And so the next slide. So I like to start off with this graphic. So when I started doing work in this area, this depicts, this is using national data on where people go for treatment when they have an alcohol use disorder. And what the main point from this graphic is that in general, people don't seek treatment, but where we tend to see the biggest disparity when we're talking about Latinos and other racial groups is in the use of specialty alcohol treatment services. And this has been documented time and time again using robust national data, using well-powered data sets. And when I'm talking about specialty alcohol treatments, so specifically talking about in and outpatient services, rehabilitation services, so those type of services. And so if you go to the next slide, whenever I give a talk, I like to pose this question. So why aren't Latinos going to treatment? And some of the general thinking around this area is that the Latinos experience a disproportionate amount of barriers specifically related to access and affordability of services. But what we find when you delve into the data a little bit more, you find that there is not strong empirical evidence for this claim. And so if you go to the next slide, what part of my work has been doing is try to understand why aren't Latinos going to treatment. So we did a qualitative interview, a qualitative study where we asked people with an alcohol use disorder, what are some barriers that you're experiencing in terms of going to treatment? And what we found from that is that and this is a highly acculturated sample, meaning that for the majority Latinos were US born. And so there was barriers related to culture, barriers related to, when I say culture is also like a misunderstanding in terms of why Latinos even drink for general. So not going to treatment because treatment providers don't really understand the lived experience of being Latino. They don't understand experiences of discrimination, experiences of immigration related issues. Also cultural factors in the sense that they're not, treatment may not be culturally accepted in Latino culture. And that was the primary driver of, or the primary reason that people were stating why they're not going to treatment. There's also, in relation to culture, because of that aspect was missing, a lot of Latinos also perceived that treatment was being ineffective. So it was being ineffective because they're not taking into account all these cultural factors. We also found that many participants, Latinos included, did not necessarily want to be abstinent or sober. So even when there's a recognition that, yes, I want to go to treatment, I want to cut down on my drinking, but I want to be able to enjoy a glass of wine and dinner. And so why would I go to treatment if they're going to tell me to be abstinent? So also taking into account of harm reduction approaches, or even expanding what is the definition of recovery for individuals. And that may vary. For some individuals, that may be complete abstinence, where for other individuals, I mean, maybe kind of cutting down. And so if you go to the next slide. So with that qualitative interview, we've expanded to try to, so we recruited a national sample to try to develop a better questionnaire in terms of why people are going to treatment. And so we use that qualitative data to develop question items in terms of assessing people's attitudes, their norms, and perceived controls in terms of going to treatment. And if you go to the next slide, what we're finding is that this is being confirmed with national quantitative studies as well. So what we're finding from this study is that, yes, cultural is a primary driver in terms of when we compare white and Latinos, why they're not going to treatment, immigration related issues, and also lack of family support and treatment stigma, both of those being related to stigma in terms of going to treatment. And then the last slide, just to very broadly summarize this work, is that barriers related to culture and attitudes seem to be the primary drivers of why Latinos are going to treatment, not necessarily barriers related to cost and affordability. And culturally tailored services may be needed. And it's important to note that in our studies, that's what Latinos are saying, is that they're saying we need more services that talk specifically to Latino issues, and also integration of alcohol and substance use services in non-medical settings may encourage use. So that's very broadly my work and the literature.
Wonderful. Thank you, Miguel, for sharing that. And I see several questions here about the slides. As always, the slides will be available on our website next week, as soon as we have a video compiled there as well. And we'll send an email out to everybody who was registered to remind you that those materials are available. So now I want to transition us to our 3 RCC directors. And before I do so, I just want to remind you all of some of the relevant findings from our recent survey we did with RCCs nationwide. And in there, we found that in terms of the demographics that RCCs across the nation report is that about 1 in 5 of RCC participants identify as Black, and about 1 in 5 RCC participants identify as Hispanic or Latino. So this is a lot better than what formal treatment is doing, that there is actually much better engagement. In terms of the actions by RCC staff, we asked them what kind of things they do, and 1 in 2 RCCs report actively engaging in targeted outreach efforts towards BIPOC in their community. So there is a lot of reason for us to believe that RCCs are particularly welcoming and appropriate place to engage BIPOC communities in recovery. And still there is lots of reason and lots of areas of improvement. And speaking to that point, if we can go to the next slide, I want to introduce our three presenters, one of whom is not here, but the 3 people who have put together this information for us. Yamila Rollan Escalona, Angelo Lagares, and Thomas Guerra. And Angelo and Thomas will be leading us for the slides today. If you can hold your comments, you can put them into chat, but we'll discuss at the end when they are done. Over to you two, Angelo and Thomas.
Hi, good morning. And my name is Angelo Lagares. I'm a person of long-term recovery, and what that means for me, that I'm not there in jail and I have the opportunity to get information, right? information to and made that decision to be in this process. The importance of cultural elements building recovery community. This part here was Yamila. The art was so important in this presentation that we're going to capture like all the elements of culture, right? And she did a great job creating this. And you can see in this picture, you know, all like elements of dancing, how we dance, the sports, you know, different elements of, and basically the music, you know, and it was important for us to present this. We was looking for how we're gonna do, you know, the first part, and I think this is everything, yeah. All basically the elements of culture in this picture here, and the art is by Yamila. Not that she was supposed to hear, she's not here with us today, but she's part of our Cultural Compliance Alliance. Next. That's Tomas.
Did we lose Thomas? He looks frozen.
Yes.
Do you want to fill in, Angelo?
Yes, of course. This curriculum was adapted from the other curriculum that it was made by me. And then we adapted this. And this is a 4-hour training, right? And we adapted, talking to Bettina and talking, we adapted to like half an hour, right? And Yamila was supposed to be here too. That's why we're gonna have like, but we're gonna try to do the best. Next slide. Okay, this is Yaya Por Vida Foundation, Lara, you know, all these three organizations, non-profit organizations, we are in Florida, right? But we work nationally. Cultural responsible compliance, recovery support services, we're trying to present this to support, you know, federal regulation, implementing linguistic and translation responses, developing guides and toolkits, recovery support services that follow the recommendation of CRC. And we're doing this because we found that the compliance, right? Like for treatment, for RCOs, you know, for the whole ecosystem of recovery, we really think, you know, that, you know, people like, we're good, people talk a lot, like, you know, like about diversity, inclusion, but really, like nobody complies with cultural competence, and that's why we're trying to create this awareness. We try to, you know, we're speaking in national and here in Florida about ways to how we can develop systems, you know, more culturally responsive. Next one. And then we're going to see today, you know, what is the Cultural Compliance Alliance, you know, history in the war on drugs, cultural elements and language, ROS, cultural responses, a system of outreach, culturally responsive, peers, the importance of peers, building recovery and recovery capitals for communities, and building RCO linguistic and culturally responsive element. Next. And here, we decide to tell, you know, our stories, right? This is a really important part of this curriculum, because everything, you know, I founded LARA, Latino Recovery Advocacy, and I got into this work because this situation that happened in my life, right? And this picture here, and the left we see my cousin Felipe Ruiz. You know, that's my little cousin, and that's me like 30 years ago. And my cousin had a horrible death, you know, overdose. Back in, he died in the 90s. He was HIV positive, and those days, the stigma, right? And the lack of information. And my family was dealing with my cousin for years, like since the 70s. But my family had no information. My family was like this Latino family, the stigma, lack of information. Imagine now we don't got information. Imagine 1980, right? And always that big denial. We don't talk about drugs, like they didn't talk, that's shame, And my cousin was HIV positive, and then he left the house because he was living with his parents, and he left. He was living in a small hotel, and he overdosed. He was using heroin since 1970s. He was part of the heroin epidemic from 1970s in New York, and he died. And the other picture is my friend Corpus. His name is Corpito, like the Corpus Christi Day, and this guy was a beautiful human being, right? And and he died like in drug-induced paranoia led him to jump from the building. It was like catastrophic. And like these two people, I know hundreds of people, like they never had a chance. They went to jail, they went to the prison system, but they didn't have a chance to have like information in their language, right? To get information about recovery, the opportunity that I got. And that's what I'm working so hard in this, because these stories, and it's only two people here but I know hundreds of people that were affected directly by the war on drugs and the AIDS and the crack epidemic, and and that's me, really, in my addiction. And then we put this picture when I went to Congress, in 2019, and what recovery do for me, giving me the opportunity, that my cousin didn't have, that Corpito didn't have, like recovery, life, and that's why we put my picture there, my mugshot. And then I put, that picture from 2019. We'll go to the next one.
Right. Hello, everybody. I just had a mini heart attack because I lost the internet, but I'm back. So I do want to introduce Yamila's slides. She wasn't able to be here today, but she's a big part of what we're doing here. And she's in this because of many things, but the main reason you see here is some photos of her sister. Her sister, Yaya, was the main reason. She passed away from an overdose a couple years ago. And this led Yamila to get into this field. Throughout her whole experience as a family member, she realized some of the barriers that were up against her sister. Although her sister did speak English, there still were elements and barriers because of the culture. And she went to different treatment centers across, the United States, across the state of Florida. And not every place is the same. Not every treatment, not every recovery center is the same. And they learned that the hard way. An also important element of Yamila and Yaya is their love for art. And as you can see it for the first slide, Yamila put that together, and she took some time, and we thank her for that. And that's part of what she does today, is incorporate art. Art is part of culture. And she absolutely incorporates that into her outreach and incorporates that into the work that she does. So we definitely miss her today, and we'll definitely hear some more from her when she gets back. Next slide, please. And so a little bit about myself. My name's Thomas Guerra. I'm a person in long-term recovery. For me, that means I haven't had a drink or a drug since September 12th, 2014. And I'm very, very lucky. I'm a second generation American. My first language was English. And the main reason for that was that my brother, 4 years older than me, was taught Spanish early on, and he experienced barriers immediately. My mom is Mexican descent and born in Mexico, and she didn't know the language coming to the United States. She saw the barriers that it was in receiving services, not only in the medical field, but in everywhere. And she learned the language. She learned the language. She learned English, and still getting barriers to receiving service. And when she has an accent, and so people treat her differently, even though she's working towards speaking the language. People will treat her differently because of that accent. And so because of that, my family, tried to avoid that in my life. And I was able to, I didn't know how lucky I was until later on in life. Because of the fact that I spoke English, and because of the fact that I had a lighter skin. It did pass me by, and I didn't realize that I had it a little different than my parents did had growing up. But when I got into my active addiction, we started seeing some more of these barriers, and for my family to reach out for help and to get help was a little difficult, because of the cultural element, because of the fact that we don't talk about that we don't bring it outside of the family. But as a result of my recovery, I was able to go back to school and get into collegiate recovery and to get in these spaces, where we're not represented as much in the college space and in the RCO space. And I have my experiences, and I got to use it in one of the biggest platforms of my life, was getting recognized in my graduation, for my recovery status, and for trying to make some differences on campus. And that's a direct result of other people helping me. And so we're continuing to do that. We want to make it available to everybody, and that's why I'm here. This is really Angelo's work, and I jumped on board because I respect him so much, and I respect the vision that he has, and that is primarily why I'm here today. So let's jump into the next slide, please. So we're going to get right into it. War on drugs. This is not anything new. It's not a new term. When we think about the war on drugs, a lot of times we think about the Nixon and Reagan era, but it did really start before that, with Harry Anslinger, really primary in starting the war on drugs. After prohibition of alcohol was ended, he needed something else to do, and he focused on marijuana and drugs and targeting minorities and people of color. And this is not something new. This is a known fact that he is a known racist, and he targeted people of color. And it even came out later on. This is how the DEA was created. Although they have different policies now, the starting was the U.S. Treasury Department of Federal Bureau and Narcotics, and that's Harry Anslinger starting that. And so this is where the roots of the war on drugs starts, through racist and through targeting people of color. And even if you've read the book Chasing the Scream, right, it documents that perfectly in how he treated Billie Holiday versus Judy Garland, and really making her Billie Holiday's life a living hell, when she was really suffering from a substance use disorder. Next slide, please. All right, we got the word cloud. All right. So we're going to do a little something fun. So the question here, or would you like to do that, Catherine?
Yeah, I can do it. Lily just put a link in the chat. You can either use that to access the word cloud. So this is for all of the seminar attendees to take part in, just to see what our collective minds are at. The question is, what barriers has the war on drugs created for people working together in the recovery space? And you can also use your phone to the phone camera with the QR code, and it's going to ask you to enter 3 words of what you think is a barrier that's been created for people working in recovery. And I'll share the live as well.
So the size of the words here signifies how many of us typed in this word. So you can kind of see our collective thoughts in it and the words that come to mind most frequently when we're thinking about the barriers that were created. And you can also feel free to retype new words, go back to it if there's a particular one that you want to emphasize and really captures what you were thinking.
And we're starting to see a lot of the words, that are coming up bigger: discrimination, stigma, fear, incarceration. A lot of these direct result of the war on drugs. We got mass racism, right? Distrust, and that really the distrust comes in how people of color were treated since the beginning because of the war on drugs. Right.
Great, very true. Shall we move on?
Yeah, so we could get to the next slide, but I want to thank you for everybody for participating. And
absolutely.
This is definitely not, we're not bringing up anything new. This is stuff that we know, and we're here to focus on solutions. Next slide, please. Right, a lot of these words we saw in the word cloud, right? Discrimination, mass incarceration, lack to access to recovery support, the culture, the distrust. And these are all a direct result from the policies and that were laid into law a long time ago that are still in effect today, that are affecting policies, with particularly mass incarceration, where most of the folks that are in there are for drug offenses, right? And the punitive sentencing policies for certain drugs over others. And then, we bring into the cultural barriers, which we're also on the word cloud: stigma, silence, in the communication with professionals, taboo, and the belief system. So definitely, it's still to this day, we're having the after effects. Next slide, I think, Angelo.
Yes, thank you so much for that, Toman. In understanding that in the original presentation, the war on drugs is like 1 hour, right? Like we have to understand the war on drugs to understand how difficult it has been to create system of outreach. And when we did the research, and I've been doing this work like for almost like 10 years, understanding how the war on drugs continue to affect, like why it's so difficult to create system of outreach. And then, we found that out, that the policy, the protocol, even to get a grant, like, and in community college is going to be difficult because all the structure that come from, from president to president, like get tough on drug, get tough, that policy, right? All those policies now is changing. Now it's changing because the people that are dying is the people who got access to Congress. The kids, now with the opiate epidemic, it's affecting the people that can change the law. It's affecting the people that got access to media, right? And that's, in the other presentation, we go through all those steps. We hope we can share the presentation with you. But here, recovery-oriented system of care, right? How this, earlier, the doctor was speaking about ineffective, right? It's going to be ineffective, now in recovery-oriented system of care, but we're talking about any intervention, any, intervention, any treatment, any system, family support, recovery, residence call, any ecosystem of recovery here, right? If we don't got those elements, because when we talk about recovery-oriented system of care, we talk about person-centered, family-oriented, community. This is the definition of recovery system of care. But to really be person-centered, we have to understand, the norm, the rituals, the values, the symbol. This is part of culture, right? And I got in my notes here, when we talk about cultural competence, it's the ability to recognize the importance of race, ethnicity, and culture delivered in behavioral health services, right? It's going to be lack of understanding, okay, lack of cultural knowledge in providers, and culturally responsive environment, is going to fail, right? Culture is essential for healing, right? Culture is essential for healing. And the best example that we can put here is Don Covey's, the Will-Victory movement, right? This is the best example for culturally specific, right? And when we go to Latin Americans and Don Covey's, how they take that movement, everything in those environments of healing have to be with the culture, you know. It worked for them, that Latin Americans, you know, like Don Covey's back in 1988, he started, you know, getting sober and working, and he created, you know, system where the belief system, custom, language, symbols, all that. And the intervention, though, got all these elements. That's what we talk about, elements of culture, and any intervention, any treatment, right? Let's go to the next one. And then when we talk about elements of culture, we're using the Latino part here, but this works for any culture. This works for any language, in any system, any culture, right? And when we talk about language, so important. How are you going to connect with me if you don't speak my language? How are we going to communicate? How are we going to organize that community if we don't speak my language? If you don't understand my culture, how are you going to help me, right? To mobilize, to organize, to engage the community, it has to be in the language, in that specific language. And I'm going to repeat that. Not even Spanish, can be Portuguese, can be another language, but we have to get those elements to be able to deal in a system so diverse like this country. Every community is diverse, right? How important it is to tell my story. But to tell my story, I got to work through with that community. One of the greatest things that happened in the recovery movement was like Greg Williams, right? The Anonymous People. When Greg Williams came with Anonymous People and told that story, you know, that revolution, everything. How are we going to tell my story if you're not going to understand me? You know, how am I going to tell my story if my community got all this stigma, all this stuff? Oh, we don't speak about drugs. Like we big in drug culture. We sing, you know, corridos. We sing songs about, you know, Pablo Escobar and killing. You know, we sing songs about the drug culture. But we're going to talk about healing and wellness, right? Like I've been to South America doing this work, you know, and when I go to Colombia, you know, and you talk about open about drugs, they all that shame. But this is Colombia, right? But they so familiar with the narco culture and the drug culture, but they're not familiar with the wellness, right? With the other part. To open the conversation, we cannot continue to talk about mobilizing community and changing policy and you know, and recovery and building recovery community if we're not going to talk about justice, right? This is about humanity. All this curriculum is about humanity and civil rights. The advocacy movement, advocacy, is the fight for human rights. But who gets to be human? Let's go to the next one. And here, you know, a peer is essential in building community, implementing, you know, building community, creating recovery capital, implementing. But the representation, Tomas was saying, you know, it's important. People like me, okay, like when we building, is something here in the notes that I wanted, you know, that I want to read to you guys. That it's really important, right? When we're creating a curriculum, when we building a community of colors, right? Or BIPOC community in general, you know, the participation, right? The development, implementation, cultural responsive practices, the participation of the community. Intervention cannot be successfully applied when generated outside the community or without community participation, right? The community got to participate in the plan, and this is here, improving, TIC 59, improving cultural competence, the protocol. This have like 10 years, and this it's been years, right? We got all the information we got about cultural competence in all these DEI groups, and talking about diversity and inclusion, but we have to stop the conversation and create more action, right? It's about now. It's not about the conversation. It's about changing policy, because once again, this is about human beings, right? Addiction is a universal experience. It's a human universal experience. Let's go to the next slide. I think before this, it was something that I was going to say about that, how system can adapt to all the culture. Like when we talk about holistic approach to recovery, now we go yoga and meditation. I think that slide, maybe Yamila didn't send it, but we talk about yoga and meditation, they come from thousands of years, from thousands of years, right? And you can go to any part in the United States, and you see those elements of all the culture, like yoga, meditation. We got like 12 techniques, with meditation and yoga. And you can see that like all systems like AA and NA, you go to any part of South America, any rural, I've been in mountains, I've been like real far, deep in the jungle. And when I go to the little town, you see that sign, AA, and the language, it's the same tradition, the same program, but the language, that's how important we can adapt. All systems are universal. Healing is universal. Wellness is universal, right? And that's and we talk about okay, let's go to this one because I get really like crazy with this. Let's go to the other one, please. To back. Okay, the idea is that a bilingual peer, okay, can train a Spanish outreach coordinator, and that Spanish coordinator go to the community. But this is something crazy. It's now one peer support certification. 58 million people that speak Spanish in this country. Now one state got a certification. This talking about this Paris, right? No, it's more than 25,000 treatment. I'm talking about with all levels of care. How many cultural linguistic treatment, quality treatment and take? Because you got a lot of Spanish treatment that not funded, that like therapeutic community, faith-based, with no supervision. You got those a lot, but treatment for 60 million people. Not one peer support certification, and that's what we're trying to do. That's the fight here. Let's go to another one. And when we talk about cultural responses system of outreach, how are we going to do that outreach? How are we going to connect? How are we going to connect with those communities? We go to community leaders, pastors, RCO, political representatives. We do the town hall. That's the first thing that we do. We do a town hall and understand what's the culture, what's the language, what's the need for this community. Can be Portuguese, not have to be Spanish, can be all the language, can be, African American community, can be whatever, but we have to be cultural responsive. We have to be ready. We have to have that ability to help that community. That's why we do a specific system of outreach, right? Let's go to the other ones, you, Tomas.
Right. And Yeah. Thanks, Angelo. And so, you know, I think you did mention this on the recovery-oriented systems of care, but adding the culturally and linguistically responsive, right? When you mentioned, you know, being person-centered, individual-centered. How are you going to focus on the individual if you're not including their culture and their language, right? I'm going to speed this up. The next slide, please. And so we want to add this into every aspect. You know, what does it mean? We want all systems, the language accessibility, behavioral health equity, system of outreach, accessibility to information and training, recovery ecosystem, right? Angela spoke about this as well, you know, and so we want to add this into every aspect in every system. Next slide. Okay, and so how are we gonna make sure that people do this, right? And I know everybody has good intentions and people want to say, yeah, we want to do this, we want to follow through, we want, you know, but when it comes down to it, a lot of times it falls through the cracks and it gets pushed to the bottom. But you know, on some of the questions you had earlier, what are some of the things that we could do to, you know, get people to be comply? And Angela has a great, you know, analogy when it comes to the ADA and folks with special needs and disabilities, right? Everybody requires ramp access for people with wheelchairs, right? It's part of the law, and it needs to be done. And so these are some of the things that we look at when it comes to being culturally compliant in language and everything. And so there may be laws in the books that say we need to do that, but are people following through, and are people having consequences if they don't? So that's some of the things that can be discussed with legislation. Next slide. Is that yours, Angelo?
I can do, you know, and we go the same way, you know, barriers to effective outreach, you know, it's non-cultural compliance. You know, I think somebody was saying that we comply with the law, not with good intentions, you know, like no cultural compliance, excessive bureaucracy. That's like, you know, that's the other policy and the politics from Reagan for all the war on drugs. It's still bureaucracy to be able to get a certification, to be able to get a grant, systemic barrier, you know, in the whole recovery system. Healthcare distrust, like how I'm going to trust if my uncle went to jail for half an ounce of marijuana and now they're selling marijuana, you know, like legally, like all this distrust, right? Generational trauma, all that mass incarceration, all the traumatic, catastrophic that was the war on drugs. Discriminated policy, we're still dealing with that. That's why we're doing advocacy, and mass incarceration is like big. Let's go to another one. You know, and this is what we need, like right now. This is like an emergency, you know, like how fentanyl and how deadly it is. We got this information in Spanish. We need that information, not only in Spanish, any language. You know, what is your community look like? What language they speak? You know, and then you have to understand your community to be an RCO, right? The fentanyl, you know, recovery into system of care. What is that? You know, LGBT community recovery support special in Spanish, you know, or bilingual, medication-assisted treatment. We don't believe in medication, you know, like, because remember that we come from abstinence-based, and that's not, we change all that. Everything is changing. Medication-assisted treatment, Suboxone, methadone, you know, Narcan. We're going to see all this work where we work hard to this company be able to have everything in Spanish. We worked like 2 years to make this happen. Harm reduction, the great Andrew Tatarsky, he's always going to have like we're going to do all the translation with Tatarsky and harm reduction in Spanish, right? The language is addiction. We don't talk about crack anymore. It's substance use disorder. You know, all those dialects, you know, from the great the dialect of language, you know, Robert Ashford. Robert Ashford's always saying, you know, take all my materials and translate it. He's always so open to give me the opportunity to translate, you know, the language of addiction. Stigma, we have to work, but all this, we need to have that in RCOs, you know, bilingual, that feel the need of this community. Many pathways of recovery, right? Smart recovery, we got that in Spanish, you know, MARA meetings, you know, like all this menu, all this great, You know, all recovery meetings, we got that same Spanish, but not only translated by Google, but have that cultural aspect. Important, not only translate that, but the cultural aspect, even though in Tomas' case, sometimes the kids can speak English, right? But his culture, the way he saw the abuela, the tia, in his home, you know, how the culture is so important that we put in this system. Let's go to the next one. Tomas.
Yeah, I don't think we have time to play this video, but like Angelo said, he worked years on working with Narcan and Adapt Pharma so they can get the Spanish material. So there is now a Spanish one-pager. There's a Spanish videos here, materials available so people could understand what Narcan is.
If you can play 2 minutes of the video so the people can see,
okay.
like 1 minute.
We can also add the video link to our website if it makes it easier for people to access it.
Should I play a minute of it or?
Yeah, play like 3
Please
seconds.
do.
Can everyone hear it?
La sobredosis de opiáceos es la principal causa de muerte accidental en los Estados Unidos. Casi 500,000 personas murieron por una sobredosis de opiáceos entre 1999 y 2019. Cada 8 minutos en promedio alguien muere por una sobredosis de opiáceos. Y como la mayoría de emergencias por sobredosis de opiáceos se producen en casa delante de un ser querido, estar preparado en una emergencia por sobredosis accidental.
And that's, you know, Narcan putting their resources into the Spanish material, right? And it took a while, but I got to give it up to Angelo that he doesn't take no for an answer, and that's how we should treat this. We don't take no for an answer because it's necessary, and now people can understand what Narcan is, you know, in the Latino community. Next slide. And working as well, Angelo, you know, it's fairly simple when you have the right resources and you connect with the right people, and there's no overhead and bureaucracy to it. It's easily translatable, you know, and we have those resources available, and they could come out at the same exact time as the English materials. It doesn't have to wait 2 years later and come out with the Spanish materials, and that's available. Next slide.
And to say this, you know, like, this is when no funding, right? A lot I funded myself. It sounds insane, right? But this is when no funding. This is like, you know, translated this and put it in this art, you know, it's going to save life. You know, we have to continue. It's simple. It's not that difficult. Have that, you know, like if you got it in English, you can translate it in Spanish and put it out there, because this is like, this can save a life. You know, what is fentanyl? You know, the 988 number that, you know, I did the translation for the state and they give me permission and I did it in Spanish. And I know we can do this. You know, I know that with this information, we can transform the systems. Thank you.
Right. And all right. And we came down to the end. And so the goal out of this whole, you know, workshop is collaboration, solutions, and getting rid of some of those barriers. We have some resources. Angelo's worked hard to get some of these together. We also would like to collaborate and reach out. That's what we're here for. That was the goal of this seminar. And we encourage you to reach out to us. Of course, we always, you know, as Angelo said, there hasn't been too much funding in this area with us. So PayPal is available through Lara Recovery. And again, we thank you. Next slide. I think we're at the end. How much time we got?
It is now 4 minutes until people have to log off for other meetings.
Okay. So Angela's been working on this, and we recently connected with other countries, Mexico, Cuba, Colombia, Dominican Republic, and sending materials to them that they don't normally get. They're very 12-step heavy, and so other access to other pathways to recovery is very important in getting into these other countries. Next slide. So again, to recap, the war on drugs has been effective for 80 years. We want to create these systems that are inclusive and diverse, and change these systems that were created through the war on drugs And we want to build RCOs that are culturally and linguistically appropriate. Addiction doesn't discriminate, health disparities kill, and it's a basic human right to access information. And that's for everybody, regardless of where you're from, what language you speak. And next slide is our contact information, I believe. Thank you again.
Thank you so much. It was almost impossible to do this in an hour. This is like 4 hours, but this is our information. We can, Carolina is there, Tanya is there. Like we can let's contact, and let's do, we can do this in each organization. We can present this, we can present the whole curriculum. Thank you so much for being. This is part of the conversation that can change everything. Thank you so much. Appreciate it.
Thank you.
Thank you, Angela and Thomas, for sharing this and for pulling this together. This has been incredibly wonderful. If you can do a stop screen, a share, so we can see each other. This is great, and I agree with you. We have a contact information on our website. Please do reach out. Please do keep the conversation going. I saw a ton of great sharing in the chat for resources, thoughts, ideas. An hour is absolutely not enough. We will come back to this topic from a different perspective of new ideas. Tell us what you need to hear. Tell us what you want to work towards. Use each other's. Let's keep this going. And Thomas and Angelo, this has been fantastic. Thank you so much. And Miguel, if you're still here, thank you as well for your intro. Unfortunately, we're out of time. We have like 2 minutes, 1 minute for thoughts, comments. I see a lot of love for Angelo and Thomas in the chat here, which is awesome.
I just put my email in the chat. I work for Palm Beach County. We have a RCC opening up. We've already leased it, paid first month's rent. It's opening in Lake Worth in a predominantly Latino area. We're only hiring bilingual employees, and you can get involved if you know anybody that's in that area that wants to get involved. I put my email in the chat. Please contact me. We want to get local ownership. Thank you.
Amazing.
I want to thank you guys for this opportunity to be able to hear it in my language, to be able to understand fully and have that representation, because we lack it as a Latino community. And if it is, it's centered in one pinpoint of a map when we're all over the place. But unfortunately, we don't have the language, and we don't have the people that look like us for the trust factor. So I appreciate the hard work in your own recovery and the work you've done for my community. Gracias.
Thank you. Thank you.
Oh, Angela, you're muted. If I see you talking.
Yes, my email's there. Bettina got my information, write me, the guy from Palm Beach County. I'm in Palm Beach County, even though that I work national too. I'm in Palm Beach County. I work 24/7, creating, system and relationship, en Espanol, to the African American, any communities. This is not about like a specific for, this is about culturally and linguistic responsive, like we can do this. I know that we can do this. Thank you so much.